Next, we will hear from the Philippines, to be followed by Vanuatu. From the Philippines, it is my pleasure to welcome back the Honourable Angelina Tan, who is the Chairperson of the Committee on Health from the Philippines House of Representatives. Angelina, over to you.
Thank you, Dr. Pratt. The Honorable Professor Kezo Takemi, our former APPFGH President, Honorable Min Seok Kim, the newly elected President of the Forum, distinguished members of the Forum, men and women of the WHO Regional Office for the Western Pacific, headed by Dr. Takeshi Kasai. Ladies and gentlemen, good day. More than a year into one of the world's longest COVID-19 lockdowns, the Philippines, a nation of around 110 million Filipinos, is confronted with a dire situation of surging COVID-19 pandemic or cases. In fact, the country less than 4 months in 2021 has already surpassed the total of COVID-19 for the whole of 2020. The nation's leadership, however, cannot afford to be distracted nor be discouraged by this predicament, not at this point that infections are nearing the cumulative total of 1 million cases. Hence, the government is preparing for the long haul by enabling all pandemic functions of prevention, detection, contact tracing, isolation, treatment, and recovery. We are providing added protection and vaccination by increasing public's immune system through medicine package and providing health services through telemedicine and home service, and the scaling up of the vaccination program through the expansion of organizational structures and designation of mega vaccination sites. We are building resilience through capacity building of our ICUs and hospital beds for severe and moderate cases, including temporary treatment and monitoring facilities. We are already gearing up for enforcement, especially for additional health workforce. Our strategy is to implement granular lockdown to curb the outbreak and the gradual reopening of the economy while strictly observing health protocols at public and business workplace. Throughout this health crisis, the Philippine Congress, particularly the House of Representatives, has been proactive and purposefully engaged in responding to the needs of times. Congress has passed the Bayanihan to Heal as One Act, or Bayanihan 1. Bayanihan is a Filipino word which refers to a spirit of communal unity and cooperation. This law provides for the declarations of the existence of national emergency arising from COVID-19 situation and a national policy to address the crisis. The law grants the President special powers to address COVID-19 outbreak, such as the adoption and implementation of measures to prevent further spread of coronavirus, expediting and streamlining the accreditation of testing kits, facilitating the testing by public and private hospitals, as well as immediate isolation and treatment of patients. The law provides low-income families emergency cash aid and gives health workers a special risk allowance on top of their regular hazard pay. Almost 6 months after Bayanihan 1 became a law, and its sequel, Bayanihan 2, but now known as Bayanihan to Recover as One Act, was passed into law. It extends special powers to handling the pandemic and provides 165.5 billion pesos fund for addressing the health crisis. And now, with 224 members from the House of Supermajority, led by Speaker Lord Alan Velasco, together with minority and independent blocs, a trilogy appears to be an Afing Bayanihan 3 or Bayanihan to Arise as One Act. This third economic stimulus package is envisioned to provide a much-needed lifeline to individuals, families, and businesses severely affected by the pandemic. The Philippine Congress has also passed the COVID-19 Vaccination Program Act of 2021, which aims to expedite the procurement and administration of COVID-19 vaccines in the country. The country's COVID-19 vaccination program started officially on March 1 this year. As of April 21, a total of 1,353,107 Filipinos were already vaccinated. Among them are workers in frontliner health services, elderly, and persons with comorbidities. The Philippines has already issued 6 emergency use authorizations specifically for Pfizer BioNTech, AstraZeneca, Gamaleya Sputnik, Sinovac, Bharat Biotech, and Janssen, making it the second country behind Hungary to issue the most EUAs. The Philippines is now number 4 behind Indonesia, Singapore, and Myanmar in vaccination rollout among Asian countries. Simultaneous rollouts across prioritization framework is expected to be launched in June to include the A4 group or the frontline personnel in essential services, including uniformed personnel. All these were made possible because of the swift enactment of the COVID-19 vaccination program law. But expediting the vaccination program will largely depend on the issue of vaccine equity, for indeed, inequity will deleteriously impact our fight against the pandemic. Several pandemic responsive legislations are also making a headway in the legislative mill, such as the proposed Philippine Health Security Act and a bill on the creation of Philippine Centers for Disease Prevention and Control. The Committee on Health, which I chair, has also approved the procurement and stockpiling bill to ensure access to critical drugs and medicines, vaccines, devices, and materials during health emergencies. We are also working on the proposed establishment of the Virology Institute of the Philippines, a research institute that will delve into the study of viruses. The proposed creation of the Medical Reserve Corps, which seeks to reinforce the existing health workforce, was already passed by the House and is now pending in the Senate. While we work to address COVID-19, it is also important that we do not lose sight of the fact that tuberculosis remains to be the world's most deadly infectious disease that kills more than 1 million lives each year and affects millions more. TB symptoms and those of COVID-19 are quite similar, both being infectious diseases that attack primarily the lungs. A TB patient, already stigmatized for having symptoms such as fever, cough, and shortness of breath, will not actually create diagnostic confusion, but can experience further stigma as they may also be viewed as having COVID-19 infection. This double stigmatization may prove to be a tall barrier that could hinder more people from seeking immediate medical attention the moment they exhibit such symptoms. We need to do something about this. But because of COVID-19, the government is hard-pressed to ensure the continuity of essential health services, such as those of TB services. There are growing concerns regarding the displacement of critical health programs, particularly TB elimination. This is unsettling as estimates show that up to 6.3 million more people will develop TB between now and 2025, and 1.4 million more people are expected to die as cases go undiagnosed and untreated because of the community quarantine and lockdown. According to Stop TB Partnership, COVID-19 related lockdowns have significantly set back the global effort to end TB by a massive of 12 years. This situation is a war within war, and we cannot afford to lose on both fronts, where so many people all over the globe are dying and suffering not only of COVID-19, but of tuberculosis as well. May I therefore urge everyone to continue and even intensify the provision of essential services for TB patients, even as we battle to curb the COVID-19 pandemic. Addressing the age-old pandemic that is tuberculosis and the present COVID-19 pandemic are two critical tasks that each of us must confront. I call on members of the parliament to craft policies either in a broader context of poverty eradication, social amelioration programs, or decongesting the growing metropolis, or in the form of legislative initiatives depending on the country context and experience, such as economic stimulus package for those individuals and industries affected by the pandemic. We urgently need an efficiently institutionalized global health security to fast-track the realization of universal health coverage. The world is in crisis, our region is in crisis, and as parliamentarians, we need to rise to the challenges of the times by crafting vigorous, sound, and responsive legislations that will strengthen our institutions, capacitate individuals and people's organizations, improve social and health systems, and ultimately heal the world. I wish to thank each one of you today for this opportunity. Good morning or good afternoon, everyone.
Thank you very much, Congresswoman Tan, for that update from the Philippines on COVID, but also for the reminder that COVID-19 is not the only very serious health issue that we face.